Let's welcome back our co-hosts. He is a New York Times best-selling author because they never bother to chart the West-selling ones. Mr. John Gilstrap.
Good morning.
He fought in Vietnam. Then he took on the House of Delegates in the state of West Virginia. Which was more difficult? John Doyle, you tell us.
Oh, boy. You asked me too quick. Good morning, everybody.
Hello there. Good to see you, sir.
And you and everybody else.
Well, if you've been watching any football, you notice in the month of October, some players wear pink, right? And they do that in honor of their moms or grandmas, wives, whatever, that they knew, women in their lives who had breast cancer. And that's the reason why you see players wearing pink. It's National Breast Cancer Month. And in studio with us is Nicole Sergent, who we know from West Virginia birth to 3. But today, she is here as a breast cancer survivor. Nicole, good morning. Thanks for coming in.
Good morning. Thanks for asking me back.
Quite a story you have to tell here.
Yes.
Right. So when did you first find out that you had breast cancer?
I was diagnosed in March of this year. I do have a family history. At 40, I started receiving mammograms as recommended for all women. And those mammograms came back with a letter. You guys probably don't know because you've never had one, but women get a letter in the mail after a mammogram giving them the results. 50% of women have what we call dense breast tissue, and that means that the tissue is made of more dense tissue, more fibrous tissue, not fat. Early tumors especially are easier seen in fatty breast tissue, which 50% of women have. The other 50% have dense tissue, and I am one of them. So I would get this letter in the mail that said, your mammogram's clear, but just so you know, we have dense tissue, so there's not really everything we can see, which is an uneasy feeling, of course, especially with a family history. I started talking to my family in other parts of the world who have different insurance systems, and I was realizing that some of my family was receiving breast MRI. So I started asking that question to my provider, why am I not getting that? And the answer, I think, was insurance. Insurance won't cover that. Over the years, I started getting more frustrated with that, and I started getting a little feisty with advocating for myself. And eventually, they gave me an MRI. So for 3 years, I was every 6 months either having a 3D mammogram or an MRI. And for 3 years, those results were fine. But my August last year mammogram was fine. My March MRI showed a small, deep tumor on one side. That tumor was not detected on mammogram or ultrasound. And so when we're talking about breast cancer awareness in October, I think the most important thing is that, we always want women to get mammograms starting at age 40 earlier if you have a mother who has had breast cancer. But if you are dense, and this is something I don't think is talked about a lot, you have to advocate for yourself for additional imaging in many cases. You are scored with dense tissue, either a level C, which is mostly dense, or a level D, which is very, very dense. We know that 50% of women are level C, 10% are level D. Women who are level D have a 6 to 7% higher chance of having breast cancer. Level C, you also have a higher risk, and 50 to 60% of early tumors are missed on mammograms. So I feel very fortunate that mammogram caught my tumor, because not only do I feel like it saved my life, but it also dictated the care that came after, which was much less invasive and taxing than it could have been had it not been detected later on.
So had you not had relatives in other countries who were getting a different type of care, would you have even known to ask for that type of care?
I don't think so at the time. I'm hopeful that with more awareness and women talking about this more, that's one of the reasons why I wanted to come, that people with dense breast tissue will learn that they need to ask their doctor about those questions. Doctors in that category C do look at a combination of their risk assessments. They can look at, do you have a family history and do you have dense breasts? And they can make a decision with their patient about who needs ultrasounds or MRIs in addition to mammography. But I feel like if I wouldn't have known that at the time from my family in Canada, I wouldn't have known to ask for an MRI.
Now, I was asking you prior to us going on the air whether yours was genetic or environmental, and you had some interesting information about how the study of genetics has
Correct.
increased here.
So I'm a physical therapist and a big believer in evidence-based practice and research funding, of course. Years ago, my grandmother and great-grandmother had breast cancer. I've since found out some other distant cousins have had it as well. My grandmother was tested for BRCA1 and BRCA2 years ago. In 2008, that was available at the time, and she was negative. My mom was tested a few years ago, and there were 20 genes they could test that led to breast cancer. She was negative. My testing tested for 40 genes. So in just 20 years, we've been able to identify 20 more genes to routinely test for breast cancer patients. And my genetics were negative. The genetics team told me that even though the genetics were negative, there's obviously something familial in my family. I also had an aunt that passed away from ovarian cancer. And so we don't know, is it a gene that has not yet been identified by research, or is there something familial, where we lived, what we ate, what was in our air and water and soil? So, the research is continuing to evolve to try to figure that out.
And what has your course of treatment been like?
So I had the option of a lumpectomy with radiation or a double mastectomy, and I chose a double mastectomy. So I had that in May. It was, it's a hard surgery, but I had a lot of support and I have a great medical team and I did well. I had a reconstructive surgery after that, and I will preventatively be getting my ovaries out next month. Something that is also not talked about, I feel, that is very, very cool is obviously there's a lot of research that drives breast cancer treatment. Even as a physical therapist and a medical provider, the ways that I knew that I learned that it drove treatment as a patient were surprising and miraculous to me. So from the time I had a biopsy, they were able to identify the receptors on my cells that caused my cancer to grow. So they were able to identify that it was not an aggressive tumor and that it was driven by hormones. So estrogen and progesterone grow my tumors. Because of that, I will take medication for 5 to 10 years as long as I can tolerate it, because there are side effects that will deplete me of those hormones to stop future tumors from growing. In addition to that, after my surgery, I received something called an oncotype. They took my tumor, they looked at the genetic blueprint of that tumor, and they were able to specifically tell me that if I took those medications, my chance of a reoccurrence was a certain percentage, and if I did chemotherapy on top of that, it was a certain percentage. And for me, the chemotherapy added less than a 1 percentile difference. So they were able to make an objective decision and recommendation that chemotherapy would probably do me more harm than good. It wasn't a guess, and that's because of research. In addition to that, going forward, I will get a blood test called Signatera, and that can detect free cancer cells in my body. So before it was, tell us if you feel anything or if you have any pain. By then, a lot of time the cancer that has returned is too far gone. This helps with early detection, and that's all based on research. And then the last thing that I think is really cool is my tumor is somewhere in a jar, and in 5 years, they will retest it to see if there are any new medications that will help to keep me from a reoccurrence. So because of all this, I have become obviously personally affected and definitely an advocate for cancer research funding, which we know has significantly been cut this year. And it feels very personal to me to advocate for that, not just for myself, but for anyone. I mean, when I will tell you, when you're waiting, I waited 14 days on biopsy results. You don't care how you voted or who you support politically. You care that there's going to be a clinical trial or a treatment to keep you active, healthy, and involved with your family as long as possible. And the data shows us that 7 out of 10 Americans support that cancer funding. So it's something that in a very divided world, we're somewhat consistent on, which is good and important.
I've been down that road a couple different times.
Yes.
So that's a remarkable bit of education you just shared with us. And as many times as we've talked about Breast Cancer Month on this program, that's the first time I've heard a lot of that information. So
yes,
good stuff there, too.
I will also tell you, 1 in 8 women are diagnosed with breast cancer in the United States. Every 2 minutes, a woman is diagnosed. So it's very common. It's the most common female cancer, specifically female. I think skin is the most common overall, but for females specifically. We know that we're seeing an increase in younger women. When I was diagnosed, they said to me, you should feel assured that the 5-year survival rate is 99%, which was great news. But I'm 48 years old. I want the 20-year survival rate, the 30-year survival rate. And to be honest with you, they don't have that data because this used to be a disease of older women. We were seeing women be diagnosed with it in their 70s, and many of them weren't dying of breast cancer, they were dying of old age. But we're seeing younger and younger women get breast cancer. The mean age is 62, meaning half of people diagnosed this year will be under 62. And 16% of them will be under 50. A lot of those cases are in the postnatal stage for women who have estrogen or progesterone sensitive cancers and they've just been pregnant or breastfeeding. So the myth that this is a disease that only older women get is definitely not true.
Mr. Doyle.
My sister died of breast cancer about 20 years ago. She was 54. She had gotten all the mammograms they told her that she needed to. They didn't pick it up. It had metastasized to the stomach. And by the time they picked it up, it was too late.
I'm sorry.
Well, I am too. And she was a brilliant person. Mathematician, had just written her first book. So I do understand exactly what you're talking about, and I like Rob. There are some things that you have said that even during that time I didn't know about. I did not know about soft tissue versus thick tissue, or is it called
dense
thick
tissue?
Oh, dense, soft and dense. All right, yeah. I did not know about that. There are a number of other things. So, what is our society not doing now that it needs to do? I'm sure there are a number of things, but if you could pick the one thing that we're not doing, that we ought to be doing, more that we most need to do that we're not doing. Let me phrase it.
The medical system, or just our society in general?
Anything that comes to mind.
Well, I mean, I think early detection obviously saves lives. And so I think the conversation about dense tissue, if 50% of women have dense tissue and not all of them are getting secondary imaging, that could save millions of lives.
Okay.
There's an environmental impact on early cancers. There's early research on microplastics and how that's affecting us because those can be estrogen and progesterone imitators in the body. So there's an environmental concern there as well. The healthier you are, not smoking, not drinking, maintaining a healthy body weight, people know that estrogen and progesterone, which is the most common cause of tumors, not the only one in the breast, come from the ovaries, but they also are excreted from body fat. So maintaining a lean body mass is also one way to really prevent breast cancer.
What are microplastics?
Microplastic? No, I'm not a scientist, but all of the plastics that everything's in plastic, and I've learned this.
It's like packaging.
All of our food comes in plastic, our water bottles, our Tupperware, everything that we have comes in plastic. And there's chemicals in those plastics that, this is again a very dumbed down explanation of this, I'm not a researcher, but I do know that some of those chemicals are being excreted in our soil, our water, our fish, our meats, so we're not only ingesting them, we're breathing them, so I've kind of gone off the deep end. I've switched to all glass Tupperware. I've changed all my beauty products to make sure they don't have certain chemicals that have these in them. It might be overkill, but I'm a go-getter in terms of my health, and so I kind of wanted to do everything I could to keep myself alive for as long as possible.
So it goes so squarely into stuff that I feel like it's none of my business. But
you can ask anything.
I know.
I think that part of the reason why women don't know about this is that it's viewed as something so private, and people don't talk about it. And the more people talk about it, the more women are going to be empowered to take care of their health. So I am not. You can ask me anything.
Okay. So how big is this tumor? Or was
My
it
tumor was very small. It was about the size of an eraser. But so it was a stage 1. Anything under 2 millimeters is stage 1. And it was grade 1, meaning the grade is how kind of messed up the cells are. But it was 9 centimeters deep. So I couldn't feel it. I didn't have any symptoms. It was slow growing. My doctor told me it had probably been there for a few years before it was ever even detected on MRI. So breast exams are very important. Mammograms are very important. But if you have dense breast tissue, you may have something that you can't feel or see.
Well, as a male outside looking in, the double mastectomy seems like a draconian.
Yeah, it's an extreme surgery. I chose it because I had a lot of, I call it scanxiety. I was someone who was always called back after the mastectomy or after the mammogram or the ultrasound or the MRI. They're watching something. Can they really see? With the history of dense breast tissue and the stage I was in my life, I was ready to do my best job of getting off that roller coaster. It's a hard decision, and it's a very personal one for women of different ages and, different stages of life. It's serious, and there's long-term consequences for many women because of the surgery. Something that's not talked about is a lot of people lose complete sensation to their chest, meaning, you can put your hand on your heart and not feel your hand anymore. I have not had that, thankfully, but that's, people, I was listening to a doctor yesterday saying she's had patients that have been burned by a curling iron or a heating pad because they can't feel. People don't talk about that. Obviously, lymphedema can happen in the arm when lymph nodes have been disrupted. There's something called cording, which is like scarring. I have had some of that. I will also say that I went to a physical therapist. Obviously, as a physical therapist, I believe in physical therapy. But I went to Morgantown to see one of 2 oncology certified PTs in the whole state of West Virginia. Her name is Dr. Megan Burkhart, and she really saved my life in terms of my job is very physical and I needed to be able to use my arms. Exercise is my mental health. I wanted to get back to that. So few people with cancer are referred to physical therapy. The average 60 to 80% of cancer patients have a physical impairment long-term, and the average is 2.3, but only 9% of cancer patients are referred to physical therapy. And, I had an ACL repair years ago. I spent 18 months in PT regaining my strength. My incision was this big. Now I have 2 huge incisions across my chest with all the soft tissue concerns that come with that. And so few women are referred unless they have lymphedema or unless they have scar issues. And we're talking all cancer patients, head and neck cancers where jaws have been recreated from hip bones. I really think that that's something that's not talked about, is that if you're any cancer patient and you have an impairment, you should ask your doctor for a physical therapy referral, because you don't only have to get by and live, but you should be able to thrive and do what you love.
And will that generally be approved without question?
Mine was paid for completely.
Yeah.
You went to Morgantown for your PT. You went there for your surgery as well.
Yes. My care was all done through WVU Medicine under the direction of Dr. Hannah Hazard. My medical oncologist, who will manage my medical care going forward, is Dr. Zhang, and my plastic surgeon is Dr. Brook. They are the best of the best. I can tell you, I'm a healthcare provider. My husband is as well. In terms of doctors that we've worked with or that we've had on our own as patients, we were joking, it's like the Disney World of medical. That breast care center is so comprehensive. When we had an appointment at one place, the other one knew where we were. I was assigned a patient navigator. She's an angel. Her name is Prudence. She helped me navigate insurance problems, getting in to coordinate my appointments on the same day because I was traveling such a distance. I mean, their holistic care for patients in all regards is, I just can't even, I get a little teary even thinking about it, how wonderful they are to patients.
I'm getting a little tear thinking about it too, right? Because I'm knowing what you went through, having gone through.
We are lucky in West Virginia to have the Betty Pushkar Breast Care Center. They are top notch in my book.
When you first got your diagnosis, how did you know where to start, who to go to? How did you know to find your way to WVU?
Well, I'm an alumni, and my kids are there, both of them in school. We have a lot of friends in the medical community in Morgantown. To be completely transparent, I was stunned. And I had some angels that said, this is who you will see. She is the best, and we will get you an appointment. And I was at a point where I was really ready to follow their lead and trust them, because I work in pediatrics. I don't deal with grown-up oncologists very often, and they were spot on.
John, you had your hand up?
Yeah, I wanted to follow up on a question that John Gilstrap asked you, and it's very possible you don't know the answer, and that's okay.
Okay.
I'm asking you just in case you do, and that is, he asked about microplastics, and you talked about plastics. Do you know what, because I don't know, what is the difference between microplastics and other kinds of plastics, macroplastics or regular plastics or whatever you do you know?
I don't officially know the answer to that, but my guess would be that it's a broken down component of a larger plastic that leaks into our soil, our food sources. But that's just an educated guess.
All right. Thank you.
I had a friend I used to work games with 20 years ago, Ray Osborne, who died of breast cancer. And most people don't think that men can get breast cancer.
Yeah, 10% 1% of the cases are male, but it is true. And men can carry the BRCA gene and other genes as well. So if you are male and have a family history, you can be tested for that as well.
When before I spent a lot of time with him in his final years, and because he had 2 bouts with it, it came back a second time, and I asked him if he had anything that he wanted people to know about what he was going through, and he said, "Tell men they can get breast cancer too." I had no idea that men could get breast cancer, but tell them it's possible.
Yeah, and I can say, in terms of advocacy and awareness, it's important not to leave out men. And it's important to talk about all of these things that I feel like a lot of women don't know. I mean, when I get nervous, my go-to is learn, research, study. So I threw myself into reading studies and, talking to other people who had done this. And I mean, I have a whole binder full of notes and things like that. But I feel like there's not enough conversation about it. I feel like people are sort of beyond, it's pink, it's October, go get your mammogram. There's more to it than that. And so being supported by my friends in the medical community to get me in the right place was very important. I will also say our family was supported in really tangible ways from people in our community. That was very helpful. But one of the most meaningful things for me is when people said that they would call or write their representatives to ask for a refunding of cancer research.
I've got a minute and a half left here. That minute and a half is yours. What would you say to people listening to this program who are afraid to go to the doctor, don't like to go to the doctor?
Yeah, I mean, there's a lot of them. Only 67%, I think, of women with insurance get mammograms. 37% of uninsured women get mammograms. That's not enough. I mean, and we will likely see more people come off insurance in the next few years because of premium raises. It is essential. The ACA guarantees that there is not a charge to women for the mammogram, or there's no copay. It doesn't count in your deductible. That protects us to make sure mammograms are covered. So don't not go because you think it's not going to be covered. It's covered. The other thing is, don't put it off because you're scared, because an early breast cancer is a treatable breast cancer, and you can live a very full, active, enjoyable life.
It was wonderful to hear your story. I'm sorry you had to go through all that.
Thank you. Thanks for having me.
And all the best to you in a couple weeks when you go back in.
Thank you.
Will that be it? I
hope so. Knock on wood, we'll be done. I've had enough surgery this year.
Nicole Sergent, thank you so much.
Thank you.
And all the best to you.
Thanks.